This is John Geaver for MedPage Today. Last December, newspapers across the Midwest carried reports of a bizarre outbreak of neurological illnesses among workers at 3 pork processing plants in Minnesota, Indiana, and Nebraska. Here at the American Academy of Neurology's annual meeting comes the first scientific report on the clinical investigation into this outbreak, which has now affected 24 workers. Dr. Daniel Lachance of the Mayo Clinic led the investigation, which is still ongoing.
It became clear that there was a similar pattern of illness among a number of different individuals, such that by November 1st, we reported 12 individuals to the Minnesota Department of Health. And over the next month, the Department of Health began a comprehensive investigation at the plant, such that by December 3rd, this all became public. A number of worker safety measures were introduced at the plant, and the plant voluntarily terminated the brain harvesting procedure. It turns out that all these individuals work in the same place in the plant, called the warm room, which is where the slaughter of the animals actually occurs. And most of the cases either have worked at or have worked within a very short distance of the place in the room called the head table. And it seems that the most likely culprit in this, or at least the most obvious to date, has been this brain harvesting procedure where compressed air is introduced into the foramen magnum of the animal, and the brain is emulsified, if you will, so that it's extracted from the head. But in the process, it also becomes a fine mist that seems to float in the air around these individuals. So the working hypothesis is that these individuals are exposed to brain tissue in the air in that environment. Whether there are any other factors involved remains to be determined, but at least to date, that's been the most obvious factor involved in these workers. The patients all have several features in common, including pain. Pain seems to be a very common complaint. A sense of generalized weakness and fatigue. The degree of actual weakness has been mild in most patients, but a few have been more severely affected. Almost all have some disturbance of sensory function that through specialized testing at Mayo we've been able to identify. And then furthermore, on detailed testing such as MRI studies, electrodiagnostic studies, CSF examinations, and importantly, serological studies, a number of abnormalities have been identified that I'm going to present the data on later today. One of the more important ones and more exciting ones has been identified in the neuroimmunology laboratory at Mayo Clinic, where I spend a portion of my time, where through an immunofluorescence assay, which is sort of a qualitative test to identify potential antibodies in patients, we've seen a particular pattern that's never been seen before in our laboratory in all of the cases identified to date. With regard to the clinical course, so far no one has completely recovered. All have either improved or stabilized to some degree. There have been a few relapses so far. To date, as far as we know, there have been no new cases that have appeared since the brain harvesting procedure was terminated in December, but I want to emphasize that it's still very much early on. Cases are still continuing to come forward that may have been affected over the last several months, and it just remains to be determined whether there will indeed be new cases that have with onset of symptoms since last December or not. So to close, one of the important points is that this is an ongoing investigation. Multiple parties are involved in collaborating on this. The story may appear to be somewhat different in the months ahead than it appears right now. So stay tuned. We'll have more to come.
I'm John Geaver, MedPage Today.